Now we are having some photographs for treatment in our lab, and they're all stuck on their original mount board. The problem basically is that the custodians do not want to get rid of this mount board, which is very acidic. They're very brittle, and apart from this acidity and brittleness, they are having a lot many dormant as well as active fungal spores. And the photograph itself is showing foxing stains at the back as well as in the front. And on the front side there is another big mark which is quite similar to the foxing stain, and it may be due to some different species of fungus or maybe some other microorganism, some bacterial layer. So since a lot of problems are being transferred through this mount board, the ideal thing would have been to take out the photograph from the original, which is not that difficult because it is already detached to a greater length, and so to just take it out of this old mount board and have it in some other system of acid-free mount board backing. And but the custodians do not want to get rid of this original mount board, so we would welcome any sort of suggestions of the alternative methods by which we can minimize the damage due to the backing of board. What we have thought of till now is to create a barrier or a sort of screen in between the board and the photograph in such a way that it's not visible from outside, from back or front. And what we have thought of is of these two films is a very thin buffer tissue, and this one is a Mara sheet. So we want to create a barrier sort of film which would be a little bit smaller than the original photograph, so that it is not visible from outside, and we'll try to keep the Mylar sheet as thin as possible so that it is working well in creating the barrier, but is not looking awkward, is not making the photograph look awkward with a bulge or so this is what we are planning. Any other suggestions or alternatives for treatment of such photograph are most welcome.